first.
Yeah, sure.
It's regarding like our assignments. I was speaking to UK Versity, but they haven't got back to me. They
Mm-hmm.
said someone's gonna call me and give me all the information. I
Yeah.
just want to know about the assignment. Does it have to be exactly how it shows in the sample?
Uh, a lot of it has to be. So in the assignment, when we are checking the assignment, we are actually checking for if you've completed like the tasks. So if there's a task that says, we'll have this discussion of the assignment. We had it the first day. I'll do it the last day also. But in these assignments, if you've been given a task, you can do anything within that task so that your learning objectives they're achieved. This is what we look for actually when you're submitting your assignment. So the word count, it has to be as it has been specified, and uh, obviously the references, they have to be Harvard style. uh, you'll have to adhere to that, because if you don't, obviously then that reduces your chances of having a good grade. And what I would suggest is that you copy paste every task, and just within your Word document, within your assignment. So you that is really appreciated, because that shows us that you're following the tasks as they've been assigned to you, and you've not missed out anything. And it gives the assessor also a chance to keep a track of your tasks. So I'm not sure what you mean by when you're saying you have to have it exactly as it says, as the
As
sample
in,
says.
like in the assignment sample, it
Yeah.
says the question, then it says answers in bullet points, like in safeguarding, it'll give you all the
Okay.
points
Okay.
in safeguarding, like
Yeah. Yeah.
empowerment, em
Yeah.
empowerment, more. That and diagrams, like it's in the sample, but
Yeah. Yeah. No, those
uh,
samples. Yeah, those samples are just as examples. So you don't have to completely. You can do it different. You can do it the way you want to. They're just examples to help you. If there's someone who doesn't have any idea of doing this assignment, they can then take guidance from these bullet points. That's it. Even if you have something, you just have to make sure that your learning objectives, they're being achieved, and we see that being achieved.
so can we write them out as complete, like assignment form where it's just words, or because in the assignment brief it says, "Oh, make a PowerPoint in this scenario, make a PowerPoint like
Yeah,
this," and
no,
like,
you will have to make a PowerPoint, unfortunately.
okay,
That's
so it depends on what it says. Make a journal, make a
yes,
portfolio,
yes, yes.
and we make it like that, and then we add the referencing at the end.
Yes, yes. And within the text also, so while you're writing something, so let's say there's a statement within the text, so you'll have to give the reference for that statement also. And then you will have to reference at the end in the reference list also.
Would there be a word count if it's like a PowerPoint?
There should be, or there should be the number of slides that you have to use, or if it's mentioned, I'm not really sure. I'll have to go back and look. But if it's mentioned, then obviously. So for the word, for the PowerPoint, it's mostly the speaker notes for which you have a word count, let's say 500 or something. I'm just giving an example. But mostly for the PowerPoint, it's the number of slides, or the number of like it's the slide show for 15 minutes, let's say. In that, there's no word count, but then you have to cut down your slides. And I'll always recommend that your slides should be in bullet points. So it's succinct. Your slides shouldn't have too much information loaded on them, because it's the speaker notes that should be loaded actually. But not that, obviously not too much again. To some extent, there should be more explanation in the slideshow, in the speaker notes, and not on the slides or the bullets themselves. We'll understand what you are trying to say or trying to write down through your speaker notes actually.
Also, one last question. Is this the
Yeah.
second unit we're doing? We haven't gone through all of the units, have we yet? Is it
Um,
just Unit 3 and Unit 4 that we've done so far? It's because I'm new. I don't know how much of the course was done before I started.
you're Farah, right?
Yeah.
Yeah, Farah, I'll ask them to give you a call tomorrow because I'm not really sure. This is the administration who will be able to answer your question, this question specially.
Okay, yeah. Thank you.
Yeah, no, that's okay. Because I teach whatever they give me, I teach it. I'm not really sure what's happened before.
Yeah, I did message them. It's just it is Saturday and Sunday, so I don't think they'll get back
No,
to me.
no. Yeah, it's just like because I work part-time, so I'm here Saturday, Sunday, but the others are not here. I'll let them
Yeah.
know anyways.
Okay, thank you.
No, that's okay. Any other questions before we start? So it's a good way of asking, like obviously it's good to attend the sessions and then have a good discussion that helps everyone else also. So in this unit, we are talking about the fourth learning objective, which is understanding work relationships in health and social care. So how the different relationships, obviously, the different stakeholders in health and social care. So how do you work with those relationships within the health and social care? So a bit about the indicative content. So health and social care workers, you have all these people working there. You have all these things to think about: your colleagues, your key agencies, professionals. You have different social care aspects. You have personal budgets. You have careers advising. You have housing advocates. You have education benefits, occupational therapists. All of these could be working with you. Uh, all of these or some of these, and then person-centeredness or patient-centeredness, it's very important because it gives the person who's involved in the care process, it gives them active partnership, it makes them more empowered, and it reduces inequalities because of different opportunities that people have, and it gives them respect, it gives them an option to voice their choices, and to be aware that their choices are being heard of, and their issues and dilemmas are also being heard. Best outcomes for individuals. So when you're keeping it patient-centered or person-centered, client-centered, it reduces duplication of efforts. It keeps the delivery of care, which is consistent. It keeps it effective and efficient, the use of resources, because we know resources, they're not always going to be as much as you require. Safeguarding, we'll talk about all of these in detail. Consistency and continuity of care is very important. Sharing roles, allocation of tasks, transparency of these tasks, of these roles is very important. Role of a leader, we'll talk a bit about what the leader has to be like, role modeling, and knowledge issues. We'll talk a bit about all of these components, these these terms. So a bit about the difference between working relationships in health and social care settings. So it's categorized into 4 ways. So you have individuals and their friends and families, which are the first relationship that you should be considering. And then is your colleagues, your managers, your people, your staff, if you're an employer, your employees, people from other workplaces. Obviously, they're advocates, um, they might not be working within your workplace, but they have a say within, have a say for things like whatever happens, so that they can be quality assurance inspectors, let's say, or any people, or people from the external audit committees, who are there to advocate and help support you in changes that you would want to make, or you would be required to make. Volunteers and community groups, these are seen in some organizations. So these are different, these are 4 categories. So you can have a lot of people within these categories, obviously. These are some examples of which I've just mentioned. What partnerships do you have? So the association between two or more people and organizations also. And because people are working within their domains, when you have shared partnerships or a working relationship, it enhances the efficiency and the quality of service provision within the healthcare setting. And that should be your main aim of having that partnership. So you're working towards their benefit and they're working towards your benefit. So this acronym that is TEAM, which stands for Together Everyone Achieves More. So it's formed to achieve a larger and bigger goal, not only your goal, but the goal of others also who are a part of the team. It's a process of working collaboratively within a group of people in order to achieve a goal. So teamwork models are Dr. Bruce Tuckman's team building model, or Dr. Belbin's model, in which you talk about team roles and it elaborates on team roles, the 9 roles, 3 categories, a bit about uh, different working relationships in health and social care settings. So we've talked about what relationships, what people are involved, or what groups are involved. So those 4 categories we've talked about. So when you're working with individuals and their families, it is important that you have a good relationship, working relationship with them. Communicate everything so there's a lot of transparency and supporting them when they need your support, and giving them preference when their care plans are being discussed. So it's a great, they can be a great source of information about what works well for an individual. I just have a question. How is it that they could be like, why is it said that they're a great source of information? Any idea what are they contributing to? Why is it that they're a great source of information? So even if they are, how is that information gathered from them? Any idea? Anyone who wants to speak on this? I'll mute myself so you can speak.
So you say the question is why is their family or their relation a great source of information?
Yeah, my question was, uh, as I said, that individuals and their families can be a good source of information, an important source of information. How would you gather that information? My question is, and why is it that they are a very important source of information? You know the answer. I'm just asking you because it's reinforcement.
Yeah, they are a good source of information because they've been with that person probably from the onset, so they know exactly what challenge the person must have been. They must have been there supporting the person day in, day out. So they have record, medical record, and probably triggers or challenges of that person handy. So it's actually really, they're actually a real good source of information to you because they give you precise medical history of that person.
Yes. Any other answer? Thank you. Yeah, so it's very evident that obviously, if you have people who are, uh, they're like if you communicate with a patient you've treated, that patient can give you an insight into different other patients, the way other patients feel. So let's say you're a new employee in a setting, or you've just started you started working at a different post, and you need proper, like you need evidence, or you need information on how to deal with patients. Let's say you've never been uh, in that position, and then you have several patients coming to you from multiple ethnic groups, let's say, from different socioeconomic backgrounds, and you've never dealt with this diverse of patients or service users or their families. So if there's a patient who you communicate with, or their families that you communicate with, there'll be a window actually and let you know what is actually their expectations regarding with regards to their whatever background they have. So you don't have to go and make efforts to learn about every separate patient, to understand what they require or what their aspirations are, what their fears are. You could just take information from some patients, and this is why it is so important. So these some patients that or their families would give you good information on how to deal with such situations. So you're actually doing it for them, but then you see that they're helping you, so they're supporting you also. So this is like you have focus group discussions, you have in-depth interviews with them. So this gives you a very good understanding, because these focus group discussions, you cannot do it with an entire like 1,000 population of patients who come to you. But what you could do is that you have a good set of a good mix of patients, and just do some discussions with them and some interviews with them, and you understand what their views are on anything that they have to have their views on. And then you use this and you extrapolate this data, and you can say that you can safely say that the others, if you would have other patients, they would also have the same views. So that's a good source of information, and then that information can be a part of your research. You could actually help further researchers understand these aspects that you're working on. Relationship with colleagues, it's very important, because you want team working. It reduces the burden from you, so there's equal sharing of work. It creates a vision of common goal and set standards and managing performance. So you should always remain professional and follow your employer's agreed ways of working, and you should be reporting to your manager if there are any concerns that are in relationships. So you'll also be working with outside agencies. So you have social workers, you have nurses, you have GPs, psychologists, advocates, appointees, the dietitians, occupational therapists. So some of them will always be a part of your working relationship. So this is just a small list. The list is bigger than this. There should be Care Quality Commission, the standards set by Care Quality Commission, CQC. So they are also one of the external auditors. They're the people who are working towards improvement of the quality within your organization. So they're an example of having external relationships. An external contractor, such as a software supplier or training provided, or a tradesperson, can also be an external relationship. So what's the role of an advocate? It's to offer independent support to people who feel that they are not being heard. So they are advocating for them, and they're ensuring that they've been taken seriously and their rights are respected. This is also to assist people in order to access and understand appropriate information and services. So the basic role of an advocate in health and social care, it would be to support a vulnerable or disadvantaged person and ensure that their rights are being upheld in a healthcare context. So health and social care advocacy will mean supporting people who are unable to ensure their best interests are being taken care of. So the ultimate objectives of them are of advocacy will be to ensure that the client's voice, their views and experiences are being heard, and they are treated with respect so that yeah, and all the ethical principles are intact while you're dealing with them. The client is receiving equal and fair treatment. It's transparent, and they're not uh, 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 at the end receiving the end of ableism. So this means that uh, uh, they're not being sidelined because of their whatever status that they have. And the client is fully aware of their rights under current legislation, and they can make informed decisions based on the advice that has been provided. So these are all the roles of an advocacy, of an advocate. So what is an advocate in health and social care? The law, what does it state? The Care Act of 2014, it states that the patient should be able to take part as fully as possible in any discussion that happens in which decisions are being made about their social care. They have their views, wishes, feelings, and beliefs considered, respected at all times, and they have all their relevant circumstances taken into consideration. So this is the Care Act. These acts on these laws, they should be there and they should be provided to every individual so they understand that these are the things that this is the autonomy that is provided to the service users. An advocate is therefore required when a patient has difficulty understanding, retaining, and weighing these significant information, because everyone doesn't understand these intricate um, terms and these intricate concepts. So this is what the advocate does. He or she clears these points for them. And the local authority does not have to provide an advocate if the patient is happy for an appropriate person. So that person could be a friend, family member, or unpaid carer to support them. So when do you say that a person, what factors disqualify a person from standing as a patient's appropriate person? So there's certain factors that have to be considered. If the patient comes to you and say, I don't need an advocate, this person is a friend of mine and he or she is an appropriate person for me as an advocate. The patient, so these are the factors. The patient does not consent to their standing as an advocate, any advocate. And any advocate that you should, if you would be providing, it's still the patient's own wishes if they don't want that advocate in their care provision. They are the patient's paid and or professional carer, so they are disqualified. The local authority does not consider them or deem them their advocacy to be in the patient's best interest. So the local authorities have to be involved also. And the patient does not have the capacity to make decisions regarding their appropriate person. So you, in this situation, you would have a professionally appointed advocate, which will be necessary. So it is important to have working relationships with others. Obviously, you're working towards improving quality of care. You're working towards a shared goal. So you have shared ideas and experiences, and you learn from others. You can access specialist care and skills and knowledge, and you ensure that service users receive the best possible care. So your basic objective is in the interest of the service users, and you all comply with agreed ways of working and professional standards. So it is very important to work in partnerships with individuals and others. So because there's some things that you don't see and the partner sees through their own lenses. So this can give you a better insight of what's happening and what should happen actually. So, and it gives the individual choices and control over their lives. This is for the service users. So like with individuals with autism, they should be considered as an expert of themselves and be treated as an equal partner, regardless of what condition they suffer from. It ensures the practitioners work in a person-centered approach. That is very important. It ensures that care and support services meet the needs, wishes, and preferences of the individuals. So like parents of individuals with autism will have their unique insights to their child's needs, and those should be considered, and those should be referred over what you would suggest. So everything, whatever happens, would be in the best interest of these patients and their loved ones. Health and care professionals can provide expert clinical advice about how to support an individual with autism effectively. So you might not have the complete knowledge. You might have the knowledge, but you might not know some ways in which the other experts would help you in when you're in partnerships. So you know that tasks, they're not being achieved, they can't be achieved properly or efficiently when you're not working close with others. So if you're working very hard and you're working on your own and you have no support from others, it's hard to execute whatever. It's hard to achieve the quality that you aim for. So like, for example, a nurse may prescribe an anesthetic for a patient to have a tooth being removed at the dentist surgery. There will be no other member of staff present, so the anesthetist is the only person with whom the nurse can communicate during this procedure. In this situation, the anesthetist will need to be able to understand what is happening and the patient and with the patient, and will need information about the medication that they've been prescribed earlier. This information should be obviously they need it quick and effective. So you need to work in partnership. So this you will have in this situation, you will have to have other people working with you, so you can have care assistants, support workers to deliver planned care and health services, supporting a junior doctor. So you have a junior doctor working there during your surgical procedure, so you're giving autonomy to that junior doctor, but then you're working yourself also towards because obviously you want quality care, so that junior doctor does have a chance of experiencing that care process, but at the same time the patient is in safe hands. So that needs to be made sure of. Safeguarding children, young people, and vulnerable adults, this is very important. You can have risk assessments, and you could have conversations with other professionals for their help. So you can ask police, you can ask social workers or teachers about the potential child protection issues that are there, that exist there. You might not be able to understand all of them, or you might not be able to foresee some of the situations or that may arise. So these give you a very good they give you a good insight, these partners, in how to deal with such situations and how to expect such situations in different circumstances. So when you're working in partnerships, poor communication has serious consequences. There can be duplication of efforts. There could be wrong treatment given. There could be missed information in the medical history, such as an allergy, a diagnosis. So whenever you, even the anesthetist, if that anesthetist that I gave the example of has the best of knowledge, has the best of training, but that person will have to work in collaboration with others so that there's proper relevant information being given to that person before the surgery is performed. The surgery is obviously an important and very serious procedure, but then other procedures cannot be taken as not being serious, and everything should be taken care of because it's the patient care, whether serious or non-serious, it's their lives that you're dealing with. So you need to be able to communicate clearly and follow agreed protocols and procedures. You should actually know the protocols and procedures. You should be able to learn those protocols and procedures. And collaborative working with each member of your team is very important. By compromising this, you will be able to make a decision together. So if you're working together, so you have a compromise with each other, you're being able to make decisions together which are beneficial to all parties involved. So the benefit is not for you only, it's the main benefit is obviously for the patient, but it involves shared benefit for the others also in the partnership. So some reasons you might find that working in partnership with others proves to be advantages. You will not only gain protection from if you made a mistake, but you could also potentially save someone's life if something goes wrong. So you have some support to work there for you in case you make some mistakes, because we all make mistakes. We're not there's no thing that you're foolproof or you can't make mistakes. So when you have someone who has greater knowledge and expertise, so this will improve the quality of care and health services. It is important for professionals to take input from other team members so as to maintain optimal outcomes. So that's what should be done. It's a healthy relationship that should be there always. So that whenever need be, you can access support if you require it. So we're all new to some things. So you always need the support from someone who is at a higher level, who's experienced more than you. You will socially progress, so there'll be mutual respect and trust that will be required in order to for relationships between colleagues to flourish. So if people trust each other, they will work together better, and this is likely to benefit the patient as well. Obviously, your ultimate goal is that to benefit the patient. So working in partnership with others is very important. You would be not working, everything would not be done by you, so you will have additional support. It requires trust, good rapport, and effective interpersonal skills to build strong relationships. So here you're evaluating the role of teams in providing a coordinated approach to service delivery. So when you're working in teams where everyone benefits from working in the team, you're working in effective teams. This improves the clinical outcomes and it increases professional satisfaction. So you're satisfied with the care that you've given to the patient and provides crucial peer support that is so important, and sometimes it's the lifeline for treating a patient. A single healthcare encounter can involve interactions with several healthcare professionals, and they could be coming from various settings. And this recognizes that high quality care necessitates careful coordination and collaboration that has fueled numerous initiatives aimed at improving clinical teamwork. So you have multidisciplinary teams that could be working, and this is the mechanism for organizing and coordinating health and care services to meet the needs of individuals with complex care needs. So let's say the NHS, it works in a multidisciplinary team approach where you have the paramedics, you have the clinicians, you have the nurses working there, you have the support staff working there. Without these people, you cannot really work. The team can't be really working efficiently. The work will be there, but it's not going to be as efficient as it should be. Teams bring together the expertise and skills of different professionals to assess, plan, and manage care jointly. So there's examples that they have through their experiences. Multidisciplinary teams, they're expected to work proactively in order to support individuals' care goals. So when you're accessing a range of health, social care, and other community services, these teams focus on keeping people well and independent. So they keep them the services patient-centered and delivering the right care at home or in the community wherever it is required in order to prevent unnecessary hospital care. Multidisciplinary teams, what they are and how do they work. I'll just share this video with you. Uh, can everyone listen to this video? Is the sound okay? Can you hear it? I hope so, yeah.
Professionals can work together to deliver person-centred and coordinated care support.
So this video, it showed the mechanism for organizing and coordinating health and care services in order to meet the needs for individuals with complex needs, complex care needs. The teams bring together the expertise and skills. So there are different teams that are working, and they're expected to work proactively to support individual care goals. Through accessing this wide range of health and social care and other community services, these multidisciplinary teams, they focus on keeping people well and independent, delivering the right care at home or in the community in order to prevent unnecessary hospital care. So there's a case study, City and Hackney will talk about this. So Berkshire Healthcare NHS Foundation Trust, it's a community and mental health trust providing care for communities across the East and West Berkshire and covering 6 unitary authorities. East Berkshire is a part of the newly formed Frimley integrated or Frimley integrated care board, and it also covers parts of Surrey and Hampshire, which within East Berkshire there are 3 unitary authorities, including Bracknell Forest Council, BFC. So you have a mental health multidisciplinary team here, which is for the community and it's for adults in Bracknell, and it's jointly funded by BHFT and BFC. So this has a multidisciplinary team approach where you have social workers, you have physical health nurses, you have psychiatrists, you have psychologists, psychotherapists, and employment specialists. They're all working towards the quality care of the patients. And staff from all organizations, they work, these both organizations basically, they work with within the same building with joint management arrangements. All these members of this team use the same electronic recording system. So the differences, there are no differences that exist. So there's a weekly MDT meeting chaired by the joint service manager in order to discuss the needs for individuals, whatever care needs there are or whatever issues need to be discussed. Individuals do not attend the MDT meetings, but are given the opportunity to discuss their needs with their care coordinator. Then there's a community hub the local community network has developed a hub to facilitate collaboration between these people who are working there and the statutory mental health professionals to help individuals in their recovery. So community work members attend the MDT on a rota basis. So it's a regular thing that they have to do, the community within the community, because they are from the community. So they have a better understanding of what's going on, what the ground reality is. And then there's zoning. So the MDT is currently working on introducing zonings in which there's daily mini MDTs, mini teams that will be held to discuss meetings will be held to discuss individuals who are thought to be at high risk. It is so high risk people, obviously they need more prioritized care. So this should not have to wait for a team to wait and meet up. Instead, the meeting happens more on an urgent basis. So it is hoped that this will lead to good communication within the team and targeted case management will be possible. Improvement. So DiHSC have recently introduced a new system called I Want Great Care. This is to obtain feedback from individuals about the care that they receive. This is accessed through a link that is detailed on the appointment letters that they get from the hospital, and they can complete the form when they attend their appointments. So the format of this is it's of the MDT of the regular it's regularly reviewed by the service manager and the team leads. Sometimes, like for example, they need to balance business items with case discussions, and that resulted in recent decision to hold a business MDT multidisciplinary team meeting monthly. And this gives the service manager an opportunity to discuss wider topics, just not the topics that are discussed regularly. So the trust also have a quality improvement program, and they have with a monthly meeting to discuss progresses in improving care and achievement against set metrics. So many of these are determined organizationally, but the MDT will also be setting its own logic metric. So the MDT members, they're able to attend a monthly group facilitated by psychology, which gives them opportunity for open reflection with peers. So this is one of the ending slides that we have here. So there's here we analyze how team leadership can address challenges faced by teams in health and social care. I hope that example that I shared with you is a good one. So we share these examples because these help you in your assignments also. So you can use these in your references, or you can use examples such as these. So yeah, I hope that was helpful. So the NHS has a long-term plan. Obviously, it's got multiple multidisciplinary teams working with the achievement of their long-term plan. So it's the basic aim obviously will be regarding the patient satisfaction and patient quality of care, which they aim to improve. So they have the team effectiveness, within which they have psychological safety and trust, they have adaptability and resilience, they have attitudes, behaviors, and cognitions. So in the attitudes, you have the feelings that you express. So that's valuing teamwork, assuming positive intent, believe we can succeed, care for and include others. So there's inclusivity also in that. Behaviors what will you do? Learn continuously, you'll exchange information, you'll monitor, back up with others, and you'll manage conflict, and you will build relationships across boundaries, you'll shape decision making, you'll coordinate actions. And what do you think? What should you think? To develop shared mental models, to create situational awareness and reflect on progress. So this is a long-term plan that leads to ultimately team effectiveness. So all of these are the integral components. The organization, it has to have certain conditions, such as teamwork should be reinforced. It supports a culture, executive and division leadership on board. The team should have a proper leadership. So there's accountability, shared leadership, and coaching. There should be technical competency, so there should be proper training, capability, and proper staff people, proper staffed organizations. There should be clear roles and purposes, so the roles are defined, the teams are directed clearly, and team norms have been set up. So all of this has to do with team effectiveness. So they can address challenges faced by teams in health and social care through these models, these integral components. So if everyone is aware of these components and what they have to do and what they should be doing, it leads to overall team effectiveness, which will improve the quality of care of the patients. So to be an effective team, it's globally recognized as an essential tool for delivering more effective and patient-centered healthcare delivery systems. So a team can be defined as a distinguishable set of two or more people. So they interact dynamically, interdependently, adaptively, and this is towards a common and shared goal, objective or mission, who have been assigned specific roles or functions to perform and who have a limited lifespan of membership. So it is very important that to understand that patients nowadays are rarely looked after by just one health professional. As I gave you the example of the anesthetist, that he or she needed support, obviously. So there has to be proper communication to and fro. Team-based healthcare it's the provision of health services to individuals, families, and the communities by at least two healthcare providers who work in association or in collaboration with patients and their caregivers. So it's patient-centered, that is why. To the extent preferred by each patient, so it's their extent to which they prefer. And the ultimate goal is to achieve coordinated high-quality care. So when we are incorporating sharing responsibilities and accountability is there within team members in healthcare system, it gives benefit to everyone. So the effective team is one where the team members, including the patients, they communicate with each other as well as merging their observations, expertise, and decision-making responsibilities to optimize patient care. So the development and characteristics of successful healthcare teams, there are some different types of teams that can be identified within the healthcare systems. They're core teams. They're directly involved in caring for patients. So you'll have the nurses, the dentists, pharmacists, doctors, assistants that work directly with these patients. They're also called case managers. They can also include case managers. Then you have coordinated teams, people who work in coordination. So they're group responsible for operational management, coordinating function and resource management for these core teams. Then you have the contingency teams that are formed to deal with emergencies or specific events. So you should have these contingency plans and contingency teams, like the cardiac arrest teams, disaster response teams. Any contingency team that you can think of, any example? Any other team that you can think of that could be a part of the contingency team? Mm-hmm.
Hello?
Yeah, I'm hearing.
Yeah, I think part of the contingency team
Mm-hmm.
are also the is it orthopedics? Those
Mm-hmm.
those who work for the NHS
Mm-hmm.
who are in the in those all those emergency team
Mm-hmm.
that always respond to the call from whether
Mm-hmm.
from the care home or from the different houses for
Mm-hmm.
emergency purpose.
Mm-hmm.
I think it's also part of the contingency team.
Yes. So anyone else?
We call yeah, paramedics.
Yeah, paramedics, yes.
Yeah.
So will
Red Cross.
paramedics be the core, sorry, will a paramedic be the core team member, or will that paramedic be the contingency team member? Just a question.
Sorry, come again.
So you mentioned about a paramedic being a part of, I don't know, will the paramedic be a part of the contingency team, or will that paramedic be a core team member?
Yeah, paramedics also there are also part of the contingency team. It's two sessions. Some are because the way I look at it, so some of them attend to call emergency issues.
Yeah.
Why some are on standby? Because I could remember when you call the paramedics, before they can link you to those that will be in support, that will be attend to you, they are in first of all they speak with some team before they link the call. So I think they're also part of the contingency team.
Yeah, so they can be a part of the core team as well as the contingency team also, whenever needed, wherever they are needed. Then you have certain, thank you for your responses, thank you. And then you have ancillary teams or services. These are group supports services that facilitate patient care, like cleaners or domestic staff. You can't do without relying on them. So they're an integral part of the team. Support services and administration, again, they're there for 24-hour assistance, and they help in overall functioning of the organization. That's about it for this presentation. You have, I think you have 2 more LOs right after this. So this is the 4th LO that we've completed, and then you have 2 more learning objectives. And that brings us to the end of this session. Any questions, please let me know. You have this email that I've shown you. You can share your concerns or whatever questions you have with the team. Yeah. Any questions?
Yeah, the question is that I missed the class yesterday.
Okay.
So I don't know if you can still share the yesterday record on the WhatsApp.
That's okay. I can ask them to share it with you. That should not be an issue.
Okay.
But I would always recommend you, if there's any, obviously, any unavoidable circumstances in which you're having to miss the class, that's okay, that's understandable. But otherwise, there's always a very good generation of discussions, which is very essential for these sessions to be carried out. Otherwise, you have all these sessions available on YouTube anyways, and you can Google them and find your...
okay, I'll find out.
I'll let them know, and they'll share it with you. They've shared the previous ones there already.
Okay, thank you very much.
That's okay. Any other questions? But I'll let them know your concerns, and then they'll give you a call probably tomorrow, and then you can discuss what issues you have. Is that okay? Yeah, that should be fine.
Thank you so much for the class. Yeah.
Yeah, that's fine, Esther. Yeah. Any questions again, please let me know, and have a nice week, all of you.
Yeah, thank you.
Yeah, you're welcome. I'll see you.
Thank you.
Thank you. You're welcome. I'll see you Saturday then.
All right. See you.
Bye. Yeah. Stay safe. Bye.